Have you made an appointment, Brad? Are you going to be donating blood?
I did make an appointment, and it turns out, Trevor, that because I lived in England in 1993, I was not permitted. There's a risk for people at that time of mad cow disease.
Well, that's what someone with mad cow disease would say, Brad. Brad Smith, how are you, my friend?
Hi, Trevor. I'm sitting here in Seattle, and like you in New York, we're all spending a lot of time inside our houses and apartments at the moment.
One of the big things I've wondered about is, as Microsoft, you have so many employees who come in together to create together. Has that completely changed now, or have you just used all the tools that you've basically almost prepared for this by being Microsoft? Are you now just testing all of those tools at a scale that you never imagined?
In a lot of ways, yes. I mean, everybody's working from home, except if you have to be in at a data center or something. And we all have teams, and we're all spending hours a day on video calls. But we're finding that the tools work really, really well. But I think what has even in some ways been more interesting than that is just everybody's sort of scrambling to address the issues of the moment, as they should.
Right.
Like we have, we serve 50,000 people a day in our cafeterias, and we still have some employees that can come to work, and they're making 6,000 box lunches a day for homeless shelters, and school kids, and the like. We have all the people that run our supply chain. Suddenly they're out globally buying surgical masks so they can be shipped to hospitals.
Wow.
We're taking our technical capability with something like Teams and making sure that businesses and nonprofits can continue to operate, and we're providing free services.
One of the reasons I wanted to jump on with you is because I've been intrigued by the relationship and the conversation Microsoft has been having with blood drives and blood donations. I spoke to you about a week ago, and I remember you telling me that, one thing that has suffered during this crisis because of social distancing, which is necessary, has been people donating blood. And I remember thinking to myself, well, I mean, I know everyone wants to donate blood, but how do you donate blood at this time? And I still don't fully understand what that means or how people can get around that.
Well, I thought you would ask about that, so I thought I would phone a friend and bring in Gail McGovern. She heads the American Red Cross.
Obviously, some people may ask the question, they might say, is it safe for us to be doing this? We understand that you have these measures in place, but is it worth us coming out and risking ourselves to donate the blood? Why is it so important for blood to be donated during this time? Shouldn't that pause? What would you say to those people?
Well, first of all, we ship about 6.5 million blood products a year. And in order to do that, 13,000 people a day have to show up to donate blood. And blood is used for cancer patients. It's used for people that have had trauma or an accident or have open heart surgery. My guess is that everyone knows at least one person who's had a blood transfusion. And it's the gift of life.
What are the steps Microsoft is taking to help? Can you help during this time?
At Microsoft, we're opening up a building, and we will have a blood drive. It's all with the approval and the support of the state public health authorities. But we want people to be able to come in. We want to create a safe environment.
Gail, for those who want to donate the blood, though, how do they go about this? I'm sure there are a lot of people out there thinking, I would love to help. I would love to donate blood, but I don't even know where to begin, especially during this time.
We are asking people to either go to our website, which is redcrossblood.org. We're asking them to download an app, and they can make a blood appointment through our app, where they can call 1-800-RED-CROSS. And the important thing about that message is that they use one of these vehicles to be able to make an appointment. Because walk-ins are problematic, as you would expect, because we're trying to social distance. And we also are trying to spread these appointments out over the coming weeks and not have throngs of people present at once.
Have you made an appointment, Brett? Are you going to be donating blood?
I did make an appointment, and it turns out, Trevor, that because I lived in England between 1990 and 1993, I was not permitted, although I'm told that this may be waived. But there's a risk for people at that time of mad cow disease, although that was a long time ago. And so far.
Well, that's what someone with mad cow disease would say, Brad. I'm glad that the Red Cross has these protocols in place to make sure that people are safe. This actually makes me feel safer. I didn't know that they would ask you all these questions. That's really amazing. Well, I'll tell you now, I've got to go log on to the app, and then I definitely don't have mad cow disease. So hopefully I'm more eligible than you are. Thank you both for joining me on this, and thank you for moving everybody forward.